Hello and welcome to Positive Parenting. My name is Deanne Conrad. I'm the Community Relations Supervisor for the Sioux Falls School District. We thank you for joining us today on Positive Parenting. It is a joint venture between the Sioux Falls School District education professionals and the medical and child development professionals from Sanford Health. Our topic today is, when do you go to the doctor? When do you stay home? When do you go to urgent care? When do you go to the ER? It's a tough one because there are a variety of situations and symptoms that might be a little different here and there, but so these are just going to be general guidelines. I know as a parent I question myself from time to time about, okay, I've kept child A home for 2 days and the symptoms are still the same or they're worsening. Oh my gosh, I should have taken them in when I really didn't. Or you rush to the doctor immediately and the doctor says, no, this just has to run its course. Mm-hmm. So, I think we've all been in that position where we question ourselves, and this will be a good conversation just to either help us feel more confident and comfortable in our own parenting skills, or remind us when in fact we probably should go to the doctor. So, doctor, please introduce yourself and then we will start our conversation.
Well, I'm Dr. Carrie Orstad, and I'm a family medicine physician, and I'm at the Sanford Clinic on 69th and Louise.
And I think some of those questions often come to our school nurses as well. Please introduce yourself.
I'm Molly Satter. I'm the Health Services Supervisor with the Sioux Falls School District.
So thank you both for joining the conversation, and again, we want to say these are simply just guidelines for people. There isn't a hard, fast way, and I know there are a lot of different tools out there with technology now, symptom checkers and right. That kind of thing. Let's just talk very basic. If the child has that agonizing cold, runny nose, cough, your typical run-of-the-mill cold, what do we recommend for that?
Most of the time it's just symptomatic care, and so if they're real little, flushing out their nose, otherwise getting them a nasal spray so they can kind of clean out their nose a little bit, blow in the nose, getting that all cleared out.
I have not found any one of my 3 children that appreciate that.
They do not. They do not usually. Yes, very rarely. So, and I think humidifiers, or sitting in the bathroom, turn the shower on high and just kind of steam in there. Sometimes that'll clear them out. Using the Acetaminophen or Ibuprofen for fever control or the aches and pains. Those are kind of the main things.
And just if you're not feeling well, I know one of those, the situations is, and I have to admit I've been guilty of this. I've given the ibuprofen and then sent the kid to school. Shame on me. I'm publicly acknowledging my failure as a parent. But we really shouldn't be sending them, right. Even if they perk back up a little bit.
Right. We would definitely not encourage that. We would like the child or the student to be fever-free for 24 hours without the use of fever-reducing medications. So making sure they're real clear of that fever before you're sending them back, because certainly a lot of times if you give them that Tylenol or ibuprofen, as soon as that wears off, they're feeling cruddy again, they're not able to pay attention in class, and they're just really better off at home. And certainly if they're still running a fever, they run the risk of getting others sick. So
right. I know. You question whether, okay, are they really sick, or what's the, and my kids don't typically, like when we have strep, fever doesn't come along with it for us, for strep, and where that is kind of a symptom for strep sometimes. It can be. So you kind of question, all right, are you just not wanting to take your spelling test today, or are you really feeling that rough? What are some questions that parents can ask to help get to the bottom of it, as to the seriousness of it, if they're talking to their kids and trying to find out, all right, how badly do you really feel?
Sometimes it depends on the symptoms, and some of it you can tell. I mean, you can look at a kid and say, oh wow, you look kind of crummy, you must feel awful.
Right.
But if you're just taking their word for it, the things that are helpful would be to know exactly what hurts. Is it headache? Is it stomach ache? Have they been able to eat? That's actually a pretty good indicator. If you give them something they just won't eat, they may have pretty sore throat, bad stomach, that sort of thing. Strep specifically is often fever and sore throat. Can be body aches and headaches, sometimes a little nausea. Usually doesn't have a lot of the respiratory stuff. So people come in a lot thinking I'm sure I have strep because they have this head congestion, runny nose, and it's kind of running down the back of their throat and irritating. That often is not strep. It's more of a cold virus.
Okay.
So asking them specifically what hurts, what symptoms do you have, if they can't really pinpoint it, then it's probably more of just kind of a general, I don't feel good, or
right. So when kids come into the school nurse's office and say, "Oh, I'm not feeling well," you know, is there a period of time where you're generally saying, "Okay, have a seat on the cot," or whatever the case is, or is it a lot of that quick assessment type of thing, like, yes, you really do not look at or do not look well, those types of things? I know, hey, we all like attention from time to time too.
Sure.
So if, you know, our best friend is sick, maybe we are feeling that way too, just because in sympathy for them or what have you. But how do our nurses assess sort of some of those things when kids really should not be in the classroom?
Right. So our nurses are using their assessment skills. They're certainly prioritizing needs. So it really depends on what's going on in the health office at that time. So if they have a student who, for example, is having an asthma attack, respiratory systems are going to trump probably the student who maybe in general is just not feeling well. So that student might have to wait a few minutes until they're finished with the more serious concern. And so they're just prioritizing their needs, but certainly they're assessing each student that comes in. So they would never just ignore the symptom. So they would assess the student if they feel that there is a need to contact a parent. Certainly if the student has a fever, that's an automatic call to the parent. If when they assess their throat, if they have a real red or white patches or real sore looking throat, they're going to contact a parent and recommend the student be seen. Certainly if they have vomited or have had diarrhea and it's seems to be illness related, they're going to be contacting parents. So there are just some of those symptoms that are going to get you an automatic call to mom and dad, and then some that are kind of in general, I just don't feel that well.
I don't feel right. Well, what does that mean?
What does that mean? And so just kind of asking a lot of questions to get to the bottom of it. Sometimes it is more of maybe there's something going on in the classroom that's bothering them, and so our nurses are really good at kind of trying to they're pretty good detectives in getting to the bottom of what may be the issue if it's not actually a physical related issue.
Right.
So
well, the piece for whether going to school or staying home, then when do you go to the doctor? What symptoms are enough to send you to the doctor? And then I want to make sure we touch on our clinics and the availability of some of that in our schools as well. But what are the symptoms that should really have you thinking about heading toward the doctor or making an appointment or something along that line?
Well, I think that the main things that we would want parents to watch for would be a fever that is not coming down with the Acetaminophen and the Ibuprofen.
So at first you take the temp is there.
Right.
Don't run immediately.
Right. Because, one, recheck the temp, because I swear thermometers never seem to work as well as they should.
Yes.
So, but make sure that fever is truly there. Make sure you didn't just have a kid that had 15 blankets piled on top of them. Get them kind of down to their clothes and check that temp again. Give them, whichever is appropriate for them. Some kids cannot have one of these medications, so of course this isn't going to work for everybody, but in general, give them some Acetaminophen or some Ibuprofen. Give them about 20 to 30 minutes, because that does take a little time to kick in. You should be seeing that fever starting to come down. Won't be down yet, but it'll be starting to come down. And then within an hour, if you haven't noticed any improvement, or if the fever continues to climb, it's probably worth a phone call at least to your clinic. So a kid that has had fevers for a couple of days, is not feeling well, maybe has some pain or is congested, it isn't unreasonable to bring them into the clinic, because there isn't an easy way at home to tell if they have an ear infection or if they have strep or influenza or something like that. So, I never tell parents, it's too early, you shouldn't have brought them in, because you just don't know. You don't have those tools and skills to do that at home. Having said that, if you're pretty sure, it's just cough and congestion and not much of a fever, and they're just fatigued and not eating well, but they look okay, it's probably okay to wait a little while.
Okay. And in terms of that then, when we have symptoms in the school setting that look like, oh, this person should be seen by another level beyond the school nurse or what the school nurse can do, we do have health clinics at a number of our schools, a couple of our schools that really provide, again, convenience for parents. What are some of the things that they see in the clinic?
Really anything you can see at any of the other clinics, just the common illnesses, influenza, strep, ear infections, just a variety of things like that. Injuries, if there's a minor injury, they can also be seen at those clinics. And at 3 of the clinics, they are at Hayward, Hawthorne, and Terry Redland are the elementary schools. Those 3 have exterior entrances, so actually community members from the surrounding area can also be seen at those clinics. Those are Falls Community Health, school-based health clinics. And so community members can be seen through that external entrance. Students can come through a referral from the school nurse and be seen at those school-based health clinics.
And parents are always contacted when they're...
Absolutely. We would never send a student there without consent from a parent, and parents have to sign a consent form in order for them to be seen, and then we make a phone call the day of to make sure the parent's aware that we feel that there's something going on that should be seen. And so parents are a huge part of that process. And then we have school-based health clinics at Washington, Whittier, and Axtell. And so as far as the school-based health clinics go, those students who attend that school are able to attend those clinics. We typically don't bring students from another school through that process, but certainly we have found that those to be very, very helpful in those schools.
And getting students seen and getting them back to the classroom is our reason for that, is getting them seen in a timely manner and helping them return to the classroom so that the learning can continue and that a medical situation does not exacerbate and create, where a toothache, instead of being out briefly, it might take them out for a week or something like that.
Exactly, and then that's kind of a whole premise behind the school-based health clinics, is to get kids care sooner so that it doesn't escalate to the point where you need acute care or an ER visit. You're taking care of it when it's at a much lower level. So
right. Well, your segue was perfect for talking about urgent care, acute care. Those are very convenient. Who should be accessing urgent care and acute care?
Probably their main purpose is to cover the hours when clinic is not available. So people who would normally say, you know what, I'm sick, but I don't need to go to the ER, but it's 7 o'clock at night, they can go to that acute care or urgent care. It is also available for things that happen right then. You fell and you tripped and you sprained your ankle and you're not sure if it's broken. That is available because they can do the x-rays there, but you don't have to go through the ER. A lot of the things that we see at acute care are certainly things that we would see normally in clinic, and I think that is fine. Certainly going there because you forgot to refill your medication or the clinic didn't get your medication refilled on time, that wouldn't be appropriate. That's something that needs to go through your primary clinic.
Sure. So just making common sense assessment as to, maybe in the afternoon is when the child came down with the illness, and we're just testing things right now. We're looking at fever. We're going to try the ibuprofen, that kind of thing. And then 7, 8 o'clock at night, everybody's miserable.
Yeah.
And then that's kind of your option.
Right.
At that
that'd be available for you. If you think, oh, this isn't that bad, we can wait till tomorrow, it's probably better to be seen by your primary care because they know you a little bit better and they know your health problems and your medications. But the nice thing about our electronic records, while they don't completely communicate with each other, we easily can get access to a lot of that information. Right. So if you do feel like you need to go into acute care, that works. The things not to would be if you have something serious. They don't like people walking into acute care with bleeding from some big wound. That's better handled at the ER.
Right.
And a lot of the things that they see in the ER are certainly going to be much more serious than they would see at acute care.
Sure.
If you're not sure, it's okay to call. There are certainly numbers you can call the acute care directly, or there are also the after hours nurse lines that you can certainly call. I know Avera Now and Sanford Same Day, they both have that ability to hopefully get you in to see somebody that day. So if during the day works for you, you don't necessarily have to go to acute care. They may be able to get you into another pediatrician or family practice provider.
Right. Seems like with technology there are more and more opportunities for ease of getting in, where it used to be, oh, if you call, you know, there are no appointments available, or, you know, and certainly at peak times that's going to happen. But even the online visits that are now available, where you can dial up and like the doctor or nurse sees you and you are hearing them. How, as a physician, how does that work for you? Is that something that you can embrace?
It's not something I get to do, although I would enjoy it. It would be, it'd be good. But yeah, no, I actually appreciate that is available for my patients, because sometimes they can't get in to be seen, or you know, it may be just a simple question and they don't want to come all the way into clinic just to say, okay, I have this fever, is this that bad? Maybe they want, you know, a rash to be looked at or something like that. You can't do that over the phone. And so some of the video visits do help with quite a bit of, help us quite a bit with those things. There are certain criteria that they will follow, and often when you try to access that, they will ask you a couple questions just to see what exactly you're calling about. Again, that ankle, they're not going to be able to treat that then, because they probably need to do a physical exam and maybe even an x-ray. But if you maybe have some questions about your cold or your sinusitis and you want to ask those questions, that is one of the things that it is very helpful for. They may be able to give you some guidance on whether this is something you can treat on your own, maybe obviously needs an antibiotic, or you do need to go into clinic. And so that is one of the things you may hear. You do your visit and they may say, I'm sorry, that's something you have to actually see somebody for, because they actually need to do an exam.
We have not used that in my family yet, but I've gotten on through the My Chart, and I've looked to see, okay, what kinds of things do they suggest a video visit for, and you know, those types of things. And so if that becomes an issue, one of those items becomes an issue in the future, I think it'd be interesting to give it a try, and certainly there's probably thousands out there that have already tried it, and you know, it works well for them, and really convenience. Again, we're not taking up, maybe my question isn't taking up a slot for somebody who has a more serious illness that needs to come in to be seen at the clinic, but yet I'm getting the information that I need from a trusted provider, because going out on the internet and doing your own symptom diagnosis is, okay, we've all done it, right? Of course. You check the symptoms and that kind of thing. But how about then for ER? When do we need to go to the ER? Certainly, if you're having breathing issues or you know, something of that nature.
That's probably the biggest one that they see, especially kids for in the ER, is respiratory issues. And so, especially those with asthma or that have problems previously with their lungs, those would be good ones to know that you definitely need to get them in when they start to show some distress. But any kid can do that, you know, if they have a bad enough illness, and you know, influenza's around, so that is certainly one of them that can do that. If they seem like they are not breathing well, they're gasping, they're leaning forward, they can't seem to catch their breath, that should go to the ER instead of an acute care or waiting till the next morning.
Directly off to the acute care. I know of a coworker whose son became ill very quickly, and things, you know, they headed toward the acute care, and by the time they got to acute care, it was ambulance there ready to go to the hospital, and so things do change very quickly, especially in those respiratory illnesses and things like that. Again, if there's broken bones and things like that,
that's something that a regular clinic or acute care can handle, but it depends. I mean, if it's an open fracture, is what we call it, but basically bone is sticking out, the skin is broken,
Right.
that is something that probably should go to the ER.
That's probably going to require a surgery.
That's probably going
not
to
just a
require
setting
surgery
or
at
something.
least more stabilization
Sure.
than they can do in acute care. Again, I hurt my wrist or I hurt my ankle, they can do the x-rays in the acute care, so that is certainly fine. Now they may say, yes, it's broken, you need to see a specialist or you need to go somewhere else, but that's an okay place to start with that.
Sure.
So
sure.
a lot of it is just severity. So your wrist hurts, you think you might have sprained it or broken it, clinic or acute care is fine. Your wrist is numb, tingly, pale, can't
Right.
feel my fingers, that probably is something that's more urgent.
Right.
So.
And the reason, some people head to ER because ER is always open,
Right.
but really as responsible healthcare users, we need to think about what is the best place
Right.
for that illness or injury to be reviewed, because healthcare costs go up based on if more people are accessing ER and
They
that
do.
type of thing. So, I know there's always that question is, where do you go or who should be using,
Right.
but just again, a common sense
Well,
kind
and
of
it
approach.
is. It could be some of the simple things and they don't seem simple when your kid has them, but strep throat, ear infection, those sorts of things, your kid is miserable. That's where the acetaminophen and the ibuprofen and maybe a hot pack on the cheek or on the ear or those sorts of things are very helpful. It does. I wouldn't recommend a midnight trip to the ER. It's better if you can, to get that kid through the morning and into the clinic. I think acute care is wonderful that they've extended those hours because everybody hates to have a kid who is sick and not feeling well up through the night. But no, like you said, as a responsible healthcare receiver or accessor, it's better to wait till that next day if you can.
Right. So again, these are very general guidelines because every situation is going to be different. But when you really think about the options available, whether that be office visit or the urgent care after hours type of experience, the phone lines where you can call in, talk to a nurse who will sort of triage your symptoms and determine what needs to happen next. ER if necessary, the video visits and online resources that might answer some questions for you, or at least calm your fears before you decide that you're self-diagnosing yourself and you decide, oh my gosh, I have this critical illness or what have you. It's always better to go through that progression of what do I really need and do I need it now, and that type of thing. So well, good information for all of us. I know, as I said, as a parent, I question myself from time to time, and if I let something go on and think, oh no, we don't need to go to the doctor, and then it becomes something more serious, or it ends up, then you're sort of kicking yourself thinking, why didn't I take him in? That's probably no video visit or ER or whatever is ever going to solve that issue. We're always as parents going to question our decisions. So, well, thank you for the guidelines you've provided for us today, and thank you for joining us on Positive Parenting.
Did you know kids who play outdoors have healthier lungs?
Totally.
Did you know that boys that play with dolls make better husbands?
My son has lots of dolls.
But did you know terry cloth diapers breathe better?
I did.
It's totally true.
Oh, yeah.
Did you guys know statistically friendly kids have more friends?
Yeah.
That's obvious.
Did you know most people think they're using the right car seat for their kid, but they're not?
Parents who really know it all know for sure that their child is in the right seat. Visit safercar.gov/the-right-seat to make sure your child is protected.
This is the story of a boy who is very sensitive to lights and sounds. So he built secret hiding places where nothing could get in. The boy didn't like looking people in the eye. It made him feel uncomfortable. One day, he found out he had something called autism. His family got him help, and slowly, he learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
I'm a teacher. Let me tell you what I make. I make learning a privilege, not a chore, and frustration a tool, not an obstacle. I make working hard seem easy and giving up impossible. I make an old subject feel like a fresh thought and unconventional methods common. I'm a teacher. I make more.
Most party fouls are pretty dumb. But if you decide to drink and drive underage, you could lose your license and your freedom. Underage drinking and driving. The ultimate party foul.
It's my job to pay attention to the game, and I take my job seriously.
While I'm busy watching the game, I need your help keeping an eye on the stands.
If you see something that doesn't look quite right, tell a law enforcement official.
We all play an important role in protecting our communities, and you can help.
If you see something suspicious, say something to local authorities.